Hi Healthy Buddies, I'm Dr. Tirta Wijaya. Welcome to my channel where we will discuss about various health matters. And today we will talk about honey, the natural sweetener that is often hailed as superfood. But what does science really say about honey, about its health benefits and risks, and how to use it safely? There are many comments about honey in my previous video, but some of the comments are quite misleading that I had to delete them. That is why I decided to provide evidence-based explanation about honey. In this video, we will explore the common myths about honey, the different types of honey available and their nutritional values, the proven health benefits of honey, and the risk of honey consumption that we need to be aware of. We will also talk about the safe and best practices in honey consumption, including how to spot the fake honey and how to use it, how to store it, etc. Let's get started. There are so many buzz online about honey. Some are true, but many are not. Okay, the first one is
Honey can reverse cataract.
it is not true. Up to now, the only proven treatment that can reverse cataract is cataract surgery. I already explained this in my previous video. Applying honey directly on our eyes is not only useless but can also be dangerous. Second,
Raw honey is healthier than regular honey.
the answer is it depends. When people say regular honey, usually they refer to processed honey. This process is to kill the yeast in honey, the unwanted yeast, and to prevent crystallization. It is to improve the honey's color, texture, and making it easier to bottle and to use. However, the process may also reduce some of honey's health benefits. Compared with pasteurized products, raw honey retains its antibacterial properties but can also contain allergens, toxins, etc. In some reported cases, raw honey consumption can lead to death. So, whether raw honey is healthier than regular honey really depends on what is in the honey. Third,
Honey can cure allergies.
for this one, there is no definite answer yet because up to now, there is no good quality, large-scale studies about this yet. But on the other hand, we know that raw honey, unfiltered honey, may contain allergens that can trigger allergic reaction in some people. Okay. Fourth,
Adding honey to hot tea will destroy the nutrients and release toxins.
actually there are many studies about this, and the research shows that heating honey to normal cooking temperature does not produce harmful toxins. So it is safe to be consumed in normal amount. But heating process may destroy some of the honey healthy nutrients. Adding honey to hot tea will enhance the flavor of the beverage and may lead to diabetes, obesity, and other conditions related to overconsumption of sugar. Please note the word over. The bottom line is honey is sweet and contain components that may have health benefits, but it is not a superfood. Those are some common myths about honey that I've heard before. Please type in the comment if you heard about other myths that you want me to cover in future videos. Now let's talk about different types of honey. We have pasteurized versus raw honey. Raw honey is not heat treated and have relatively high moisture content. So it will not have long shelf life. To improve the shelf life, honey is pasteurized. So this process is not to kill the bacteria. Honey has natural antibacterial properties, but it does not mean honey is bacteria-free. One of the most dangerous one is Clostridium botulinum, a gram-positive rod-shaped anaerobe bacteria that form spores when the condition for survival is poor. With this protection, the dormant bacterium can survive for years, even in antibacterial methods like honey. In babies younger than 12 months, these spores can cause infant botulism. It is a life-threatening illness because their immature digestion system is not ready to fight the spores yet, allowing the bacteria to reproduce and release botulinum toxins, or Botox for short, that leads to paralysis, even death. Therefore, never give any form of honey, including the pasteurized honey, to infants younger than 12 months. We also have filtered versus unfiltered honey. The unfiltered honey may have pollen, air bubbles, wax particles, or maybe bee parts or other debris, giving it the cloudy appearance and richer taste compared to filtered honey. Because heat breaks down honey crystal and making it easier for filtration, we can hypothetically say that no raw honey is filtered. We also have cultivated or farmed honey versus wild honey. Cultivated honey comes from managed honey farms where the hives and nectar source is controlled to a certain extent, making it more consistent, productive, easier, and cheaper. Wild honey, on the contrary, comes from wild hives found in jungle, forests, etc. The hives are not monitored by human, and the flower source varies greatly, and so does the honey taste and quality. Floral varieties produces different honey too. Manuka, clover, buckwheat, acacia honey, etc. vary in flavor, color, antioxidant properties, and health effects. For example, honey from rhododendron plants have been used for centuries as folk medicine to cure diabetes, high blood pressure, or used as a sexual enhancement for centuries. It has chemicals called cryonotoxins in it. Sometimes people use it for its intoxicating effects, but this kind of honey can be poisonous, causing blurry vision, drooling, dizziness, headache, vomiting, loss of muscle control, and heart problems. Sometimes honey can come from several types of flower. For example, wild honey and some regular cultivated honey, where the bees roam freely to collect nectar from different types of flower. This will affect the honey they produce too. And in some cultivated honey farm, the farmer may provide sugar, syrup for the honeybee. We also have organic versus conventional honey. The organic honey comes from bee foraging only on organic pesticide-free plants, that is using natural pest control. While in conventional honey, the bees foraging conventional plants that may use synthetic treatments for fertilizer, pesticide, etc. We also have pure versus adulterated honey. Well, some people refer to pure honey as the one in its original form, that is the raw honey, and others refer to pure honey as honey only, without other particles, or filtered honey. Everyone agreed that adulterated honey is the real honey mixed with cheaper sweeteners like corn syrup, sugar, etc. to increase the volume. We have special usage honey too. Some honeys are infused with spices, herbs, flowers, fruits, etc. For example, we have honey infused with chili, lavender, lemon, cinnamon, and many other things to create unique flavor and to add healing properties. Some sterilized honey preparations, for example, specific manuka extracts, can be used in wound care or eye drops in clinical contexts. Creamy honey or also known as whipped or spun honey, are created by controlling the crystallization, resulting in a rich, creamy texture. It is commonly used as sweeteners in toast, oatmeal, pancakes, etc. Now, let's talk about the nutritional value of honey. Since there are so many different types of honey with so many different methods of processing, the nutritional profile of honey varies greatly too. On average, 1 tablespoon of honey contains 64 calories and 17 grams of sugar, mostly fructose and glucose, and 70 grams of carbohydrates. Then it contains almost zero protein, fat, and fiber. Honey contains small amount of minerals like iron, zinc, potassium, and antioxidants like polyphenols and flavonoids. Honey has wide range of glycemic index between 32 up to more than 80, depending on the source of the nectar and sugar content. Generally speaking, honey is sugar, but compared to refined sugar, honey may offer slightly more nutrition. What are the health benefits of honey? First, it can be used to improve the upper respiratory tract infections and gastroenteritis in children. Several studies have linked the consumption of different types of honey with a significant reduction in frequency and severity of nocturnal cough. One study demonstrated that receiving a 2.5 milliliter dose of honey before sleep has a better effect on the upper respiratory tract infection-induced cough compared with dextromethorphan or diphenhydramine doses. Other studies shows that honey performs better compared with diphenhydramine or placebo. All of these studies agrees that honey has less side effects and better tolerated by children compared with other commonly used medicines to treat the upper respiratory tract infection. An early study carried out on children with gastroenteritis showed a significant reduction in recovery time from bacterial gastroenteritis by replacing glucose with honey in the oral rehydration solution. But please, as good as it sounds, never ever give honey in any form to children younger than 12 months. The risk of honey consumption in a very young infant is far outweigh the health benefits I mentioned just now. Honey may also have cardiovascular and metabolic benefits. Clinical trials shows that regular honey consumption can result in lower LDL cholesterol and triglycerides and higher HDL cholesterol or the good cholesterol. In another study with healthy subjects, a supplementation of 70 grams of honey every day for 6 weeks significantly improved the lipid profile compared to subjects who are given sucrose, suggesting that substitution of sucrose with natural honey may have health benefits. Different studies in subjects with dyslipidemia or diabetes with different amount of honey supplementation show similar results. Other studies suggest benefits in metabolic syndrome and improve insulin sensitivity. For patients with acute myeloid leukemia or AML and head and neck cancers, several studies shows that honey can help to alleviate some of the cancer-related complications. Using honey as mouthwash solution significantly reduce the severity of mucositis in adult AML patients undergoing chemotherapy and significantly increase patients' body weight. Similar study on patients with head and neck cancer receiving radiotherapy, treatment with honey solution as mouthwash significantly reduced the severity of mucositis and significantly increased the overall health and quality of life. Another study used honey by smearing 20 milliliter of honey all over the patient's mouth to be swallowed slowly. Most of these studies suggest the benefits of honey intake in these patients. However, the same treatment with Manuka honey in the same type of patients did not produce improvement, and it is not well tolerated by the patients. Honey also have antioxidant and anti-inflammatory properties because it contains phenolic compounds that help neutralize the free radicals. Okay. Honey also known to have antimicrobial and wound healing properties. Different types of honey has been shown to have antimicrobial effects as rinsing solution or dressing in wound healing, as mouthwash to reduce dental plaque, as topical cream to reduce inflammation, discharge, and itching in vulvovaginal candidiasis, and many other applications in different situations. However, they are not superior compared to pharmacological treatment. Honey can still be considered as an alternative if they are cheaper and easier to find, more available. That being said, it is important to note that these studies use special preparations of honey for medical use. The honey that we buy from supermarkets should not be used at home for serious wound treatments without medical advice. Now let's talk about the health risks attributed to honey consumption. One of the gravest health risks related to honey is infant botulism. Even the pasteurized filtered honey can contain Clostridium botulinum spores. These are harmless for older children and adults, but can cause serious problems in babies younger than 1 year. Infant botulism happens because baby ingested the bacteria spores, which return to their bacterial form, multiply, and start producing toxins. The bacteria can colonize the digestive tract of children older than 1 year and adult, but it is extremely very rare. Because of the presence of the healthy bacteria in the digestive tract that we call gut microbiome, they fight the Clostridium botulinum off. Young babies' gut microbiome are not ready to do that sometimes. Risk number 2 is cyanotoxins, also known as mad honey. Honey from the nectar of rhododendron flowers can contain plant toxins that cause dizziness, nausea, even cardiac symptoms, especially in susceptible individuals. Risk number 3 is high sugar content. After all, honey is sugar, and too much honey contributes to elevated blood glucose, weight gain, dental issues, etc. Similar to other added sugar, intake of honey must be limited. Other risk is allergies and drug interactions. Some individuals may be allergic to specific components of honey, particularly the bee pollen, triggering allergic reactions, even the life-threatening anaphylaxis. I have explained about allergy and anaphylaxis in my previous video, so I will not repeat it here. Please find the link to that video in the description below if you want to know more about allergies and anaphylaxis. Currently, there is not enough evidence about honey interactions with medications yet. A small study suggested that Manuka honey may have possible interactions with certain chemotherapy drugs. Another small study suggested that honey may affect warfarin and NSAIDs, increasing bleeding risk with the blood thinners. But most interactions are theoretical or require caution. So, please consult your doctor if you have complex medical regimens. What about honey use for eye health? Some Manuka-based eye drop has been studied and may be safe in regulated formulation. But unregulated application of kitchen honey directly to eyes is not recommended. Honey straight from the jar may contain particles or microbes that can irritate or infect your eyes. Medical grade honey eye application may have future roles, but leave this to research and clinicians. Now let's talk about the best practices in honey usage. Use honey as a flavor enhancer, not as the main sugar source. Despite all the health benefits of honey I mentioned before, it does not mean we can consume honey as much as we want. Limit to small amount rather than large amount daily. Honey is sugar after all, and many health bodies align with the recommendation to keep added sugar, including honey, low, limited in our diet. There is no magic dose, and there is no perfect time to consume honey. Moderation is the key. Use 1 teaspoon rather than 1 tablespoon for routine use, especially if you are monitoring your blood sugar level or if you are obese. For honey as a cough remedy, take it at night before sleep. How to store honey properly? First, you need to use a tight container to avoid moisture. Then you need to put the honey in dry environment in room temperature. If it is kept dry and sealed, honey can last for many years. Avoid contaminations from utensils and moisture to prevent fermentation. How to spot adulterated honey? Adulterated honey is common in the market globally. Unfortunately, most adulterated honey can only be spotted accurately by doing specific examination in laboratories, which may not be accessible to most people. All home tests to do so are not effective. We can do our due diligence by carefully looking for signs of additives or high sugar syrups like consistent thickness, slow pour, or etc. We can scrutinize the product label too, although it may not help in the case of intentional product fraud. The most practical way may be buying honey only from reputable local farmer or wild honey gatherer. Honey has long history in food and medicine, with some real benefits backed by research. But it's not the magic cure, and definitely not a superfood. Enjoy it mindfully, understand its limits, and always prioritize safety. That is my sharing today about honey. I hope this can be a blessing for you. If you like this kind of video, please like and subscribe so you can receive future information from me. If you have health-related questions you would like me to cover in my future video, please type in the comment section below. But please do not consult, as consultation must be done personally with your doctor. This is my disclaimer. See you in the next video. Stay healthy and happy.